Good morning. Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Juliana Manurung with the three last digits of my student ID 030. So in this video, we're going to talk about our student project with the title, The Potential Risk of Acute Pancreatitis in Patient with High Triglycerides Profile.
Okay, now we will talk about the background of this paper. Before that, let me introduce myself. My name is G Mahapraja Divasta with my three last ID number 02H. At first, hypertriglyceridemia is a condition that characterized by abnormal high levels of triglycerides in our blood, with fasting serum values about 150. And in global prevalence and also in body prevalence, it's a high number in a population, and it can lead to the serious complication like pancreatitis. Acute pancreatitis is a condition where the inflammation begins in a short time because of the pathogens or any other substance. And studies have shown that a significant number of hypertriglyceridemia patients also suffer from acute pancreatitis. And hypertriglyceridemia act as a predictor parameter of determining the severity of acute pancreatitis. And acute pancreatitis due to hypertriglyceridemia is associated with high mortality rate, high recurrency rate, and high risk of organ failure. Because that in this paper, we want to know and also we want to increase the awareness of among the readers about the importance of maintaining a healthy lifestyle to prevent hypertriglyceridemia that can induce the acute pancreatitis.
After talking about the background, and now we're going to talk about the problem foundations and also the purpose and benefits of this student project. So at first, the problem foundation. What is the definition of hypertriglyceridemia induced acute pancreatitis? And also how's the epidemiology and the etiology and pathophysiology of hypertriglyceridemia induced acute pancreatitis? And what is the risk factor, the clinical presentations and complication of hypertriglyceridemia induced acute pancreatitis, and how to diagnose hypertriglyceridemia induced acute pancreatitis. And also the last one is what is the prevention and management of the hypertriglyceridemia induced acute pancreatitis. Next is about the general purpose and also the specific purpose of the student project. So the general purpose is to know about the general information of hypertriglyceridemia induced acute pancreatitis, especially the potential risk of acute pancreatitis in patients with the high triglycerides profile. And this is the specific purpose that the first one is understanding the definitions and also explaining the epidemiology of hypertriglyceridemia induced acute pancreatitis. And the third one is about the understanding the etiology and also the pathophysiology of hypertriglyceridemia induced acute pancreatitis. And the fourth one is about understanding the risk factor and also the clinical presentation and complications of hypertriglyceridemia induced acute pancreatitis. Next is explaining the diagnosis of hypertriglyceridemia acute pancreatitis, and the last one is understanding the preventions and management of the hypertriglyceridemia induced acute pancreatitis. Okay, and the last part is the benefits of the student project. So the benefits of the student project is to enhance the knowledge about the potential risk of this acute pancreatitis in patient with high triglyceride profile, and also the general information of this hypertriglyceridemia induced acute pancreatitis. The student project will also help the undergraduate students learn more about the clinical skills needed to become medical professionals. We hope this student project will contribute to the science of the future. Thank you so much for the opportunity, and next slide.
My name is Valentino Wijaya with relation on number 116, and I will explain about the definition of hypertriglyceridemia induced acute pancreatitis. So in general, hypertriglyceridemia induced acute pancreatitis is a pancreatitis caused by an increase in the amount of triglyceride. This increase in triglycerides can cause capillary obstruction, ischemia, and also acidosis. This condition will cause the pancreas to become inflamed, which will cause the pancreatitis. So it can be concluded that hypertriglyceridemia induced acute pancreatitis is an inflammatory response of the pancreas to obstruction, ischemia, and acidosis due to an increase in the amount of triglycerides. Thank you.
Okay, thank you for the opportunity. My name is Putri, and my last digit of my student number is 067. And today I'm going to talk about the epidemiology of hypertriglyceridemia induced acute pancreatitis. So first, we have to know that 10 until 30% of the adults worldwide suffer from the hypertriglyceridemia or STG, and 1 until 10% of the cases of acute pancreatitis are caused by hypertriglyceridemia, or we call it hypertriglyceridemia-induced acute pancreatitis or STGAP. So it's so many numbers, and the hypertriglyceridemia itself may occur as a primary disorder or probably as a result of alcoholism, pregnancy, diabetes, or probably use of certain medicines. Serum triglyceride concentrates above 1,000 milligrams per deciliters increase the risk of acute pancreatitis by 16 until 20%. And if the level will increase 100 milligrams per deciliters, it will increase the risk by 4% of the acute pancreatitis by the serum triglyceride. And in patients with acute pancreatitis, the presence of the serum fluorescence is strongly correlated with STGAP. And in patients under 58 years of age, STGAP is more common in a man, and after recovery itself, STGAP serum and triglyceride levels will appear to correlate with the likelihood of the recurrence. Maybe that's all from me. Thank you.
Hello, my name is Ananta Wismaya with last series number of 198, and now I'm going to explain about the etiology of hypertriglyceridemia-induced acute pancreatitis. Hypertriglyceridemia-induced acute pancreatitis, or HTGAP, is a form of acute pancreatitis caused by extremely high triglyceride levels in the blood. The causes of HTGAP include both primary and secondary factors that can elevate triglyceride levels. Primary factors are often involve genetic condition like familial combined hyperlipidemia, familial hypertriglyceridemia, and familial dys-beta lipoproteinemia. While secondary hypertriglyceridemia alone typically does not pose a risk for acute pancreatitis. However, in patients with underlying dyslipidemia, a secondary cause of HCG may result in clinically significant increases in triglyceride level that could lead to acute pancreatitis. Secondary or acquired factors contributing to HTGAP include poorly controlled diabetes, excessive alcohol consumption, and certain medication. Maybe that's all from me. Thank you.
Hello everyone, my name is Cendrawan Han Santoso with the last 3 digits to the number 170. So, pathophysiology of hypertriglyceridemia induced acute pancreatitis. Hypertriglyceridemia is a condition where there is an abnormally high level of triglyceride in the body. Excess amounts of triglycerides are moved around the body as triglyceride-rich lipoproteins, or called chylomicrons. First, chylomicrons are hydrolyzed in pancreas, becoming free fatty acids, in which too much free fatty acids surpass the binding capacity of albumin. Unbound free fatty acids are toxic to the vascular endothelium and acinar cells, which can cause ischemia and acidosis, which triggers acute pancreatitis. Second, increased levels of chylomicrons increase plasma viscosity, in where plasma hyperviscosity can cause capillary plugging and ischemia, which eventually triggers acute pancreatitis. Only a small percentage of people with hypertriglyceridemia develop acute pancreatitis because it only occurs with people that are actually in risk factors. Thank you.
My name is Jile Ateta Ginting with the last 3 digits to the number 140, and I will be explaining about the risk factors of HTGAP. First is type 2 diabetes. So it is the most common risk factor, as a study shown that 79% of HTGAP patients have type 2 diabetes, and it is involved in the uncontrolled diabetes. So how? It is because the insulin resistance causes more lipolysis, which means more free fatty acids flow to the liver, and these free fatty acids induce triglycerides production, and it interferes with the ApoB degradation. So more VLDL is produced, which means more chance of hypertriglycerides. And next is pregnancy. And this is because during pregnancy, there is an increase in estrogen levels, which causes more triglycerides to be produced, and the pancreatic lipoprotein lipase overworks to hydrolyze these triglycerides, and it causes pancreatic cell injury and ischemia. And lastly, there's the excessive alcohol consumption, which also works the same way as type 2 diabetes, in which it causes more FFA, flow to the liver, and induces triglyceride production and interferes with the ApoB degradation, causing more VLDL. And those are the risk factors. Thank you.
Hello, my name is Lyshanda Bianca Kusuma with 3 last digits of student ID 025. Now I will explain about clinical presentation. The clinical presentation of patients with HTG-AP is generally similar to patients with AP due to other etiologies. These include severe abdominal pain, vomiting, and nausea. Physical examination may reveal the presence of HTG, which manifests as eruptive xanthomas due to persistent hepatosplenomegaly or hyperchylomicronemia on the extensor surface. Important features distinguishing HTG-AP from AP due to other etiologies were the recurrent episodes of pancreatitis and the presence of lipemic blood. HTG-AP patients are more prone to have severe disease course and more probable to result in persistent organ failure. Patients with HTG-AP also had a higher mortality rate and required longer intensive care. Thank you, and next slide.
Good morning, doctor. Good morning, everyone. My name is Kadek Asri Bintari, with the last 3 digits of my student number are 063. Today, I would like to explain about the complications of hypertriglyceridemia-induced acute pancreatitis. The complications can be divided into 2, systemic complications and local complications. The systemic complications of hypertriglyceridemia-induced acute pancreatitis, or HTG-AP, include systemic inflammatory response syndrome, acute respiratory distress syndrome, and kidney injury. Next, the local complications of HTG-AP include peripancreatic fluid collections, acute necrotic collection, and walled-off necrosis, or WON. That's all from me. Thank you.
My name is Nadya and the last digits of my pseudo number are 155. So there are numerous approaches to identify hypertriglyceridemia-induced acute pancreatitis. HTG-AP is identified by looking for 2 of 3 factors, which are epigastric abdominal pain, elevated serum pancreatic enzyme level, more than 3 times the usual limit, and the characteristic AP imaging findings. When first diagnosing HTG-AP, abdominal ultrasonography, which uses sound waves to take an image of the gallbladder in order to find gallstones and assess the pancreas status, is used. If the patient condition has not improved after 2 to 3 days of treatment and they keep on complaining of pain, CT scans are performed for additional confirmation. And when diagnosing hypertriglyceridemia in patients with acute pancreatitis, secondary risk factors such as poorly controlled diabetes, pregnancy, or alcohol use, physical examination findings such as eruptive xanthomas or signs of metabolic syndrome, and the outcomes of biochemical assays should be taken into consideration. A patient's history of diabetes, alcohol, and drug use, and also family history of dyslipidemia should all be thoroughly considered.
Hello, my name is Natasha Putri with the last digit of my student number 083. Now I'll explain about the hypertriglyceridemia-induced acute pancreatitis, or STG-AP. STG-AP is caused mainly due to high levels of triglycerides in the blood. Therefore, preventing the disease is by maintaining stable triglycerides levels. STG-AP prevention involves several different strategies, such as lifestyle change, administering preventive drugs, and avoid induced factors. The aspect of a healthy lifestyle is abstaining from alcohol, maintaining a low-fat, high omega-3 diet, exercising, losing weight, and managing secondary risk factors like diabetes. Foods with a high glycemic index raises the synthesis of VLDL cholesterol and encourages the liver to produce triglycerides. Administering preventive drugs such as fibrates, statins, and niacin requires caution due to potential adverse effects. Preventing STG-AP also requires avoiding variables that can cause it, such as cimetidine, estrogen, beta-adrenal blockers, glucocorticoid, and oral contraceptives. That's all from me. The next material will be brought by my friend. Thank you.
Hello, my name is Dewa Angelica Utami. With my last digit of my name is 098. So I will explain about the initial and long-term management. So the initial management is to measure the triglyceride levels because it needs to be monitored early as levels can decline rapidly within 48 until 72 hours. Treatment options to make triglyceride levels lower are IV insulin, heparin, and lipid apheresis. Nevertheless, evidence of using insulin and heparin to lower the triglyceride level is mostly limited. IV insulin therapy is a worthwhile treatment, moreover when combined with fasting. Lipid apheresis has shown to reduce triglyceride level by 50 until 80%. Despite that, it doesn't seem to bring clinical benefits. And the long-term management is required after triglyceride levels are lower than 500 milligrams per deciliter. This treatment is required to prevent triglyceride level increase. Pharmacological and non-pharmacological management are included. Pharmacological management involve fibrates, omega-3 fatty acids, and niacin. On the other hand, non-pharmacological management involves diet and lifestyle modification to lower fat consumption, weight loss, and control the glycemic intake. Thank you.
Okay, thank you for the opportunity. Let me continue. So my name is Hannah Clares Tanadin with 3 last digit number of student ID number is 236. So the conclusion for this literature review is that hypertriglyceridemia, which is defined as abnormally high triglyceride level in the body, is a major risk factor for various health complications, including AP, with HTG-AP being a common subtype. The risk factors including type 2 diabetes, pregnancy, and excessive alcohol intake. Patients are advised to do preventive actions such as reducing alcohol consumption and exercising frequently. By addressing these factors, individuals can mitigate the risk of HTG-AP and its associated morbidity. Maybe that's it for me. Thank you.
That's all from our explanation. Thank you.